you are not hearing me, please use the chat box to let us know, and we can try and address any issues that people might be having. Otherwise, we are going to go ahead and get started. For this presentation, thank you, first of all, for joining us this evening for Medicare 101, everything you never wanted to know about Medicare. Again, please let me know if you have difficulty hearing me, or if you're having any technical issues, you can type in the chat box, and we will try and respond as quickly as possible to get those resolved. I will be pausing at the end of each section of this presentation for an opportunity to ask questions. You can ask questions by either unmuting yourself at that time, or you can type questions into the chat box at any time, and I will address any questions at the end of each section of the presentation. This presentation is being recorded, and you will get a link via email of that recording either this evening or tomorrow for your review. I also sent a couple of emails out. One had handouts that go along with this presentation. Not necessarily need them during the presentation, but they are good to reference back to. But I had forgotten to include the slides with the presentation, so I just sent out another email with the slides for this presentation as well. So I think with that, we will go ahead and get started. So you guys are participating in Medicare 101. This is part one of a 4-part Medicare 101 series. This evening, we're going to be talking about Medicare eligibility and coverage for Parts A and Medicare Parts B. So we're going to talk about who's eligible, how you become eligible, who helps you enroll in Medicare, how you enroll in Medicare, and then we're going to talk about the different parts of Medicare, starting with Medicare Part A and Part B. We are going to start, though, with who I work for. So I am with the Area Agency on Aging, the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to remove barriers to independent living so that people are able to stay in the community and in their homes for as long as possible. And we do this by developing comprehensive systems, and we coordinate with other communities. The Area Agency on Aging for the Pikes Peak region serves El Paso, Park, and Teller counties in Colorado. I am with the State Health Insurance Counseling Program, or the SHIP program, through the Pikes Peak Area Agency on Aging. The SHIP program is a federally funded program that's designed to provide in-depth one-on-one education and information on all things Medicare. We do this unbiased. We don't sell any products. We don't endorse any specific products or companies. We are true consumer advocates. The SHIP program out of the Pikes Peak Area Agency on Aging serves a total of 9 counties in Colorado. Every county in every state of this country has access to a SHIP counselor or a SHIP program for unbiased information and education on Medicare, usually by toll-free number within their state. I have listed Colorado's toll-free number here, as well as our local Colorado Springs number. So we are going to talk about Medicare, and we're going to start with Part A and Part B primarily, which is referred to as original Medicare. But through the course of this 4-part series, we will be talking about all parts of Medicare, which will include the prescription Part D coverage, as well as Advantage plans, also known as Medicare Part C. We'll talk about Medicare supplements, also known as Medigaps, and we'll talk about other types of coverage that might be an option for some people over this next 4 weeks. But we're going to start with who runs Medicare. So Medicare is primarily run by 2 separate entities. Social Security is the entity that determines who's eligible for Medicare. So the Social Security Administration determines eligibility for anybody into Medicare. They process Medicare enrollments. So in order to enroll in Medicare, you must do that through Social Security. They provide Medicare cards, the red, white, and blue card. But once they've done that, they want nothing to do with Medicare. And any questions, concerns, or issues you may have with your Medicare benefits once you've enrolled in Medicare would be addressed at the Centers for Medicare and Medicaid Services, also referred to as CMS or simply as Medicare. Social Security obviously does have local offices. There's one in Colorado Springs. Of course, right now, nobody is seeing people in person, so that office is not open to the public. But you can contact Social Security either by their local toll-free number here in Colorado Springs, or you can call the national number for Social Security, which I've also indicated on the slide here, as well as the Social Security website. The national number for Social Security is available Monday through Friday from 7 a.m. to 7 p.m. in all time zones. Local service office hours are a little more limited than that, but there is local offices in different areas of different states. Regarding Medicare, so once you're enrolled in Medicare through Social Security, again, any questions or concerns you have regarding your Medicare coverage or benefits would go to Medicare directly. Medicare, or the Centers for Medicare and Medicaid Services, is who administers the program. They process claims, they determine benefits, they pay providers. You can contact Medicare by toll-free number, or you can go to their website, medicare.gov. There is no brick and mortar location for Medicare. They do not have offices. You can only contact Medicare directly by toll-free number, or you can use their website. And I've indicated the Medicare's toll-free number. Medicare is available by that toll-free number 24 hours a day, 7 days a week, 365 days a year. So they are available at any time for any reason. Sorry, I'm getting a chat message here, and I'm not quite sure how to address that issue. Jessica, are you looking at the chat?
I'm actually it doesn't look like they sent that to everyone, so I am not seeing the question.
They're having issues with some of the text being cut off their screen, and I'm wondering if that's anything I can even help with.
That's likely a screen view with their monitor. Sorry, whoever it is, if you need additional assistance, message me, Jessica McMullen, and I'll be able to assist.
Sorry about that. Okay. So again, Social Security is who you must contact or go through to enroll in Medicare. But once you're enrolled in Medicare, Social Security wants nothing to do with you. And any questions, concerns you have regarding your Medicare coverage or benefits would go to Medicare directly or CMS. Who can have Medicare? Basically, Medicare is available to anybody who is a US citizen and turns age 65 or older. Typically, Medicare eligibility is based on paying into the Social Security income tax system or through the railroad retirement system. So when we pay income taxes, or when our employer pays income taxes for us, some of those taxes go to both Medicare and Social Security. And that's how we buy into that system over our lifetime. You can also become eligible for Medicare at any age if you are determined to be disabled by Social Security. You can also be eligible for Medicare at any age if you are diagnosed with end-stage renal disease or kidney failure and are receiving dialysis. If you're diagnosed with Lou Gehrig's disease, also known as ALS, and any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years is eligible to purchase Medicare. So when should you enroll in Medicare? Well, these days, most people are not necessarily going to be retired when they become eligible for Medicare at 65. So you don't have to be retired to enroll in Medicare, but you also don't have to enroll in Medicare if you don't plan on retiring. You get an initial, what they call an initial enrollment period, which is typically going to surround your 65th birthday, which is for most of us going to be our first eligibility is by turning 65. So the initial enrollment period based on that 65th birthday is a 7-month window. That 7-month window starts 3 months prior to the month of your 65th birthday, includes the month of your 65th birthday, and ends 3 months after the month of your 65th birthday. Again, that's your initial enrollment period. During that 7-month window, you can contact Social Security to enroll in Medicare without any delay or penalty. We will talk about other times you might enroll, and some of those times may include potential penalties for not enrolling sooner. Other enrollment periods that you might fall under or opportunities to enroll in Medicare. So if you do not enroll in Medicare during your initial enrollment window or enrollment period, that's 7 months surrounding your 65th birthday, you may fall under a special enrollment period. Special enrollment period is for people who continue to work beyond their 65th birthday, chose not to enroll in Medicare because they were still working and had employer group coverage. Because you delayed Medicare based on the fact that you were working with employer group coverage, when that coverage ends, because you stop working, you would actually have an extended amount of time to enroll in Medicare once that employer coverage ends. You get an 8-month window once the employer coverage ends to enroll in Medicare without penalty. If you miss your initial enrollment period or you miss the special enrollment period, you would be allowed to enroll in Medicare at any year down the road during the general enrollment period. The general enrollment period runs from January 1st through March 31st every year. But if you're enrolling during that general enrollment period, your coverage does not start until July 1st of that year. If you're enrolling during a general enrollment period, it is most likely that that's when you would start incurring a penalty, which means you would pay a higher premium for Medicare based on late enrollment or enrollment eligibility only during the general enrollment period. We will talk about all of these enrollment periods in more detail as we go along here. So this is what the Medicare card looks like these days. I call it the red, white, and blue card. It will simply have your name. It will have a random series of letters and digits, letters and numbers as a Medicare ID number, and it will indicate when your Medicare Part A and your Medicare Part B go into effect. And that's all it will ever show. Medicare cards used to require a signature. They used to indicate whether you were male or female. And the Medicare ID number used to be a Social Security number. Obviously, much of that has changed in an effort to combat identity theft. So this is what the card will look like that you should get in the mail. Things that you should make sure are checked on before you enroll in Medicare is one of the most important things that you need to check on is to make sure that Social Security has your most current mailing address. Not having the most current mailing address at Social Security is one of the most common reasons enrollments never get completed and Medicare cards never get mailed or received. So it's always a good idea to make sure that your mailing address is current at Social Security. You can do that by either going online or by calling the toll-free number. And then just a brief warning, be aware of anyone who contacts you about your new Medicare card. So if for some reason you get a phone call out of nowhere, you're getting ready to turn 65 in the next couple of months, and someone's calling you about a new Medicare card, it is probably a scam because Social Security does not ever contact you by phone for that purpose. And anybody who is suggesting to you that they can provide you with a Medicare card, that they think that there's a problem with your Medicare card or your Medicare identification, anything like that is most likely a scam. And be very, very careful about what information you give over the phone to anybody in that regards. In the email I sent earlier today, it did include a couple of handouts for Social Security. One handout was how to enroll in Medicare online by creating a My Social Security account. And then the other handout was this, what you can do online at Social Security with just some general information and tips about the different kinds of things that you can do at the Social Security website. Social Security does offer the opportunity to create your own account on that website called the My Social Security account. Social Security does not require that you create a My Social Security account, but it is beneficial and they do encourage you to do that. You can also create a My Medicare account at the Medicare website, medicare.gov. Again, this is not required that you create a My Medicare account, but it is encouraged, and there can be benefits by doing so. Creating a My Medicare account is much, much easier and much simpler than creating a My Social Security account. The My Social Security account does require much more security than the My Medicare account. So the sooner you start the process of creating a My Social Security account prior to trying to enroll in Medicare through the online process, the easier that process would be. But it is a very secure account, thankfully, because it is Social Security, and it's important that that account is secure. But again, neither one of these personalized accounts are required by Medicare or Social Security. They are strongly encouraged, and they can have benefit to having those accounts. So it looks like I've got a couple of questions in the chat box. And if anybody has any questions that they want to ask by unmuting, again, you can simply unmute yourself, and I'm happy to address any questions before we move on. I've got one question. I've got a couple of questions in the chat box that I'll go ahead and address. It says, a stay-at-home mom, so taking Social Security from ex-husband, am I still eligible for Medicare? Yes, absolutely. And Medicare benefits can be drawn from spouses or even ex-spouses, depending on the situation. And that's something that you would have to contact Social Security about so that they can help you determine what eligibility you have and how. But again, typically you can draw benefits for Medicare or income from either a current or ex-spouse. But the rules vary and they're different depending on the different situation. So you would have to contact Social Security directly to find out what scenario you fall under in order to get those benefits. And then the next part of that question is, if you enroll 3 months before you turn 65, does Medicare start for you on the month you turn 65? Yes. So even though you get that 7-month window, the 3 months prior to your 65th birthday, the month of, and 3 months after the month of your 65th birthday, if you enroll in any of the 3 months prior to your 65th birthday, the soonest Medicare can start is the first day of that 65th birthday month. If you enroll the month or the months after your 65th birthday, Medicare could actually start a month or two after that. So there could be a delay in when Medicare starts if you enroll in Medicare during the months after your 65th birthday. Then I had a question about the penalty. I will talk about the penalty in much more detail in just a few minutes, so I'm going to hold off answering that question for now, and I will address it as we go. Another question is, I am on my spouse's health insurance through his employment. Should I register for Medicare or wait till he retires? We are also going to talk about that. We're going to talk about that in much more detail, both here, well, not here as necessarily. We will talk about that in much more detail in week 2 of the presentation. But if you are covered under an employer coverage through active employment, whether it's your own employment or your spouse's employment, you can delay enrollment in Medicare in favor of that active employer coverage. And when that employer coverage ends or that employment ends, you would have a special enrollment period to enroll in Medicare. You'd have an 8-month window from the time that employer coverage ends to enroll in Medicare without penalty. So you absolutely can delay enrolling in Medicare until then. And then the next question is, can you get a My Medicare account before you enroll in Medicare? Unfortunately, you cannot, because to create a My Medicare account, you must have a Medicare ID number, and you can't get a Medicare ID number until you enroll in Medicare. All right. Are there any other questions? Again, you can either type them in the chat box or you can just hit unmute and ask your questions. All right. Well, if there's no other questions, we will move on. So now we're going to talk about the 2 primary parts of Medicare, Medicare Part A and Medicare Part B. We are going to start with Medicare Part A. Medicare Part A and Medicare Part B together or combined are referred to typically as your original Medicare benefits. Medicare Part A, a couple things to take into consideration. First thing most people need to realize is that if you are already collecting a Social Security income of any kind for any reason, when you become eligible for Medicare, whether that eligibility is based on turning 65 or whether it's based on being disabled and receiving 24 disability payments, whether it's because you started collecting Social Security income at early retirement age of 62. If you are collecting an income from Social Security, when you become eligible for Medicare, Social Security will automatically enroll you in Medicare. And you could receive a Medicare card automatically in the mail up to 90 days prior to the month of your birthday or first month of eligibility. If you are not collecting an income from Social Security when you become eligible for Medicare, it does become your responsibility to contact Medicare if you want, or to contact Social Security, if you want to enroll in Medicare when you are eligible. Again, if you are actively working and covered by employer group coverage, or you're the spouse of someone who's actively working and you're covered under their employer group coverage from that active employment, you can delay enrolling in any part of Medicare in favor of that employer group coverage. And when that employment ends, you would have an 8-month window to enroll in Medicare without penalty. So again, if you're collecting an income from Social Security when you become eligible under any circumstance, you will automatically be enrolled in Medicare. You'll automatically get a card mailed to you. If you're not collecting an income from Social Security, it becomes your responsibility to contact Social Security if you want to enroll in Medicare. And if you're actively employed when you become eligible for Medicare, you can delay enrollment in any part of Medicare in favor of that employer group health coverage through that active employment without penalty. And you would have that extra special enrollment period when that employer coverage ends to enroll in Medicare, again, without penalty. So, how much does Medicare Part A cost? Well, for most of us, Medicare Part A will not cost anything. When we pay into Social Security taxes through employment, part of that tax money goes towards Medicare Part A benefits. The other thing that Social Security takes into consideration when determining eligibility for Medicare is work history. So for most of us to be entitled to Medicare Part A at no cost, we will have had to have earned that benefit. In order to earn that benefit, you would have to have earned 40 work quarters or work credits based on Social Security taxes. 40 work quarters or work credits is the equivalent of 10 years of work history paid into the Social Security tax system. That 10 years of work history can be accumulated over the course of your entire lifetime. So for many of us, we got out of school, we went straight to work. The first 10 years we worked or had work history in our lives, once we accumulated that 10 years, we had earned 40 quarters. We became eligible for Part A at no cost when we become eligible for Medicare. Did that 40 years ago. If you did not work when you got out of school, or you were a stay-at-home parent or something like that, Medicare or Social Security does continue to accumulate or record any work history that you have over your lifetime. So if you worked, part-time jobs, if you were, only worked in the summertime, or you only did seasonal work, every time you had employment and that employer paid taxes on your behalf, that work history was going towards your 40 quarters at Social Security. So it didn't have to be 10 years acquired all at once. It can be spread out over a lifetime. Once you have that 10 years of work history, you will be entitled to Part A at no cost. If you did not have any work history, you could potentially get Medicare Part A at no cost through a spouse. As long as you and that spouse are married at least 10 years or longer, and that spouse has enough work history to be entitled to Part A at no cost on their own work history record. If for some reason you don't acquire that 40 quarters of work history to be entitled to Medicare Part A at no cost, you can purchase Medicare Part A. It can be expensive, depending on how many quarters you have actually accumulated in your lifetime. Premium can be as high as $471 per month just for Part A in 2021. If you're not sure if you have enough work history or 40 quarters accumulated, you would have to contact Social Security and they would be able to tell you. You might even be able to find that information out by creating a My Social Security account online. But only Social Security can tell you if you have enough work quarters to be eligible for Medicare Part A at no cost when you become Medicare eligible. So hopefully that answered some questions that I have in the chat. Other questions I will be addressing. The TRICARE question I will address in a little while. I do have a question. If you are divorced, do you use your ex-husband's work history to be eligible? That is very possible. The key for using an ex-spouse's work history is that you would have to have been married at least 10 years or longer and not remarried in order to be able to get benefits from an ex-spouse. And again, Social Security would be able to tell you and help you determine under what circumstances you may be eligible based on a spouse or an ex-spouse. Any other questions about eligibility for Part A? Again, if you are a stay-at-home parent and you have no work history, you would be able to get Medicare coverage or Medicare Part A at no cost based on your spouse's work history, as long as, again, you've been married for 10 years or longer. So hopefully that answered most of those questions. All right, so after all that, what does Part A cover? So Medicare Part A is going to be your primary inpatient hospitalization coverage. So it's going to cover inpatient hospital stays. It's going to cover skilled care in a rehab facility. It's going to cover some home health care benefit, and it's going to cover hospice benefits. The inpatient hospitalization benefit, however, is the most commonly used benefit. So Medicare Part A will pay for any inpatient hospitalization you may ever need for the rest of your lifetime once you're enrolled. Medicare Part A covers all inpatient hospitalization costs after an initial deductible. In 2021, that initial deductible for an inpatient hospitalization is $1,484. That deductible does increase a little bit every year. And it is applied whether you're inpatient in the hospital for 1 day or 20 days. So anytime you are admitted to the hospital as an inpatient, Medicare Part A covers all costs after that initial $1,400 deductible. And that deductible covers you for a total of 60 consecutive inpatient hospital days. So again, whether you're inpatient for 1 day or up to a total of 60 days consecutively, Medicare Part A will cover all costs after that $1,484 deductible. If for some reason you're unfortunate enough to be in the hospital for longer than 60 consecutive days, Medicare will continue to pay the majority of the cost of your continued stay, but they will start applying a coinsurance, meaning they will continue to pay everything except for, in 2021, $371 a day. Again, that's for days 61 through 90 consecutively. And then if you're really, really unfortunate enough to be in the hospital for longer than 90 days, Medicare will increase the amount of that daily coinsurance that they don't pay. So if you're still in the hospital on day 91, Medicare will continue to pay for that stay, everything except for $742 per day. Once you hit day 90 or 91, you are starting to go and work into your lifetime reserve days. So starting in day 91, you get a total of 60 days over the rest of your lifetime for any hospital stays longer than 90 days. Hopefully that is going to be a rare or never situation for most of us. To be in the hospital for longer than, 3 days is pretty uncommon these days. That deductible is applied per admission. It is not an annual deductible, it is a per admission deductible. The key to that per admission deductible is it will be applied anytime you have an inpatient stay, as long as there has been 60 days between the last stay and the new stay. So in order for Medicare to apply that deductible, once you've been admitted to the hospital, once you're discharged from a hospital, there has to be at least 60 days from the time you were discharged before you are readmitted before Medicare can apply that deductible again. But there is no limit necessarily to how often that deductible can be applied within a year, and it is not yearly, it is per admission. For hospitalizations, Medicare defines a benefit period as a 90-day stay. A new benefit period again starts when you have 60 days between discharge and readmission. There is no lifetime maximum for hospitalization. So there is no maximum that Medicare will pay in your lifetime for hospitalization. They will cover your hospital stay based on this schedule of benefits as often as you ever need to be admitted to the hospital, regardless of how much the cost of services while you are in the hospital are. So there is no dollar maximum amount that they will pay. There is no daily maximum. So anytime you need to be inpatient in a hospital, Medicare will cover it. Excuse me. The same benefit schedule does apply for psychiatric inpatient hospital stays, but Medicare does put a lifetime maximum of 190 days that they will actually pay for inpatient psychiatric hospitalizations. Inpatient medical hospitalizations, there is no maximum. There is no limit to what they will cover. While you're inpatient in that hospital, Medicare will pay for any medically necessary service that you receive, whether it's surgery, transplants, hip replacements, broken bones, doesn't matter. If it's a medically necessary reason that you are in that hospital, Medicare will pay for that hospitalization regardless of the need. However, there are some things Medicare does not pay for while you're inpatient in the hospital. Primarily, it's going to be things that are not necessarily considered medically necessary. These days, personal convenience items such as a TV and telephone pretty much come standard in a hospital room. But Medicare does not pay for you to have a private hospital room unless it's deemed medically necessary, or even in a situation where there's simply no other space available for you to be admitted. If it's a situation where they have to put you in a private room because they don't have any other space available, Medicare would pay for that room. Medicare Part A also will not pay for any of the first 3 pints of blood someone might need while you're in the hospital. So if you have need for blood transfusion, or you just have blood loss and you need blood replacement, Medicare, no part of Medicare honestly covers the first 3 pints of blood. Also does not cover private duty nursing or room sitters while you're inpatient in the hospital. And it does not cover what they consider self-administered drugs while you're in the hospital. Typically, a self-administered drug is something that would come into play on the day of discharge from a hospital. So say you're scheduled to be discharged from the hospital tomorrow. It takes them 8 hours to get you discharged. And during that 8 hours that you're waiting for discharge, it comes time for you to take your maintenance medications. So the nurse comes in with a cup of pills for your maintenance medication dosage. If you take that cup of pills from her and swallow them, you've just self-administered medications or drugs. Because it's the day of discharge, you're no longer technically considered inpatient, and you might get a bill for those drugs. Just something to be aware of, not something that happens very often, but it was problematic a few years ago. So again, the key for Medicare to cover hospitalization is going to be medical necessity. And as long as you are there for a medically necessary reason, any and all medical services you receive while you're inpatient in the hospital will be covered under Part A. Any questions about any of that? Okay. Medicare Part A also covers skilled nursing facility care. Basically, this is going to be a rehab benefit for recovery or rehab after a hospitalization. So Medicare does pay for inpatient skilled nursing facility stays, but they do require that you have been admitted to a hospital for at least 3 days or more before you're discharged to a skilled facility before they'll pay for that skilled facility. And I see the question in the chat box about observation, and I will address that in just a minute. So in order for Medicare to cover rehab after a hospital stay, you would have had to have been in the hospital as an inpatient for at least 3 days or more. Upon discharge, the doctor discharged you into a skilled facility for recovery or rehab. In that circumstance, Medicare will pay 100% for the first 20 days of that skilled rehab stay. If you are in that skilled rehab for longer than 20 days, Medicare will continue to pay for that skilled inpatient rehab stay, but they will start applying a coinsurance again. So Medicare will pay 100% for the first 20 days of skilled rehab. Starting at day 21, Medicare continues to pay everything except for $185.50 per day of that continued rehab stay. Again, that $185.50 per day is considered a coinsurance. Medicare pays all or part of up to a total of 100 inpatient skilled facility days at a time. These days have to be consecutive. And if you have been in a skilled facility and you're there for 6 weeks, and after 6 weeks, the rehab, the doctors, the nurses, and everybody says that you can go home because you've gotten as good as you're going to get, Medicare will pay for those full 6 weeks. If it takes longer for you to recover well enough to go home, again, that benefit maxes out at 100 days. That 100-day benefit max is considered a benefit period. You do get an unlimited number of these 100-day benefit periods for the rest of your lifetime, but each benefit period for skilled rehab does require that prior 3-day inpatient hospital stay first. So if you say you were up on a ladder, cleaning the gutter, you fell off the ladder and broke your leg and had to go to the hospital, and the doctors at the hospital said, yep, it's broken. You spend 3 days in the hospital, then they discharge you to skilled rehab to get therapy, physical therapy on that leg so that it heals properly. And you're in rehab for 6 weeks, then you get sent home. 6 months later, you're back up on the ladder, you fall off, you break the other leg. When you go back into the rehab 6 months later, you start over with a new 100-day benefit period, meaning you get a new 20 days covered at 100%. And then starting at day 21, Medicare continues to pay everything except for that $185.50 per day coinsurance. If you are still in the skilled facility for rehab or recovery longer than 100 days, so starting at day 101, Medicare stops caring why you're in that facility. So again, Medicare pays all or part of up to 100 consecutive days at a time, but starting at day 101, Medicare benefits cut off completely. The reason being is that Medicare continues or considers a skilled rehab stay a temporary stay. That benefit is designed to get you well enough to be able to go home. Even if going home means you are going to continue to get rehab or care at home, it's designed to get you that far. If you have not gotten well enough to go home after 100 days in a skilled facility, the likelihood of you being able to go home starts to become pretty small. So if you've not gotten well enough to go home after 100 days, that's why Medicare benefits cut off, because starting at day 101, they will start to look at that facility stay as a long-term care or custodial stay. And long-term care or custodial stays are not considered medically necessary, which is why Medicare will stop paying that benefit. But again, fortunately, most skilled rehab stays average 4 to 6 weeks. So 100 days is, or should be, more than enough time for someone to get well enough to go home. But again, if you're not well enough to go home after 100 days, Medicare benefits cut off completely, starting at day 101. At that point, if you will need to continue your stay in that skilled facility, you would be looking at a couple of different options. You will either privately pay for your continued stay in that skilled rehab. You may have purchased long-term care insurance that would help cover the cost of that continued facility stay, or you may even qualify for Medicaid, the state program, to pay for that continued facility stay. Because at that point, again, it becomes a long-term care or custodial stay. Any questions about that benefit? So real quick, there's a question in the chat box about the difference between being admitted as an inpatient in a hospital and being under observation. And that's a really good question. I'm glad you brought it up. Again, Medicare will pay for you to be admitted to the hospital and for any services you need while you're admitted to the hospital. However, and this was a problem several years ago, there are situations where you might be in the hospital, potentially for multiple days even, but never officially be admitted to the hospital. If you're in the hospital for 24 hours or longer and you're never actually admitted, what the hospital should tell you is that you are under observation. So they don't consider your situation serious enough to admit you, but because you're under observation, they don't think you're well enough to go home. So they haven't let you go home. The difference between the parts of Medicare that pay for hospitalization and observation are apples and oranges. So again, Medicare Part A covers for inpatient hospitalization, but if you're considered under observation and never officially admitted to the hospital, that is actually covered under the other Part B of Medicare for that service. Because there was some issues a few years ago with people spending multiple days in a hospital, but never officially being admitted by the hospital as an inpatient, and the hospital never telling the patients that they were not being admitted, that they were under observation, there were some issues with people and the billing and how much people were getting billed for once they were allowed to go home. Because that was an issue a few years ago, Medicare now requires by federal law that if you are in a hospital for 24 hours, that hospital is required to hand you a piece of paper that tells you whether or not you're going to be admitted, and if you're not going to be admitted, why. It's called a MOON form, MOON. And right now the acronym escapes me, but it is required after 24 hours that the hospital inform you officially in writing whether or not you're going to be admitted, and if you're not going to be admitted, why. And it advises you of your rights and their responsibilities. So again, that's a really good question. It's fortunately not as big an issue as it had been in the past, but again, it's good to be aware that they're required to provide you written notification of whether or not you're being admitted. The last couple of benefits we're going to talk about under Part A. The first one is home health care, and the other one is hospice care. Both of these benefits through Medicare Part A do require a doctor to certify eligibility. Neither of these benefits have deductibles applied to them, and most services covered under these benefits are paid at 100%, with the exception of potentially durable medical equipment that might be supplied with someone who is getting home health care. That's under Part B of Medicare, so it wouldn't actually apply to Part A. But any services for both home health care and hospice care covered under Part A are paid at 100%. In order to be eligible to get those benefits covered by Medicare, again, medical necessity is key and is always going to be key for any time Medicare is going to pay for something. Medicare A or B will only cover things that they consider medically necessary. So that is the biggest, most important component of Medicare coverage. There used to be limits to how much or how long someone could receive home health care benefits through Part A or Part B, but those limits have been removed. And as long as someone continues to meet the eligibility criteria of medical necessity to receive home health care benefits through Medicare Part A or B, they will continue to get those services. Keeping in mind that, again, those services are going to be medical services. So a home health care benefit through Part A of Medicare is only going to cover medical needs at home. It is not going to provide any sort of homemaker service. So it's not going to help you prepare meals. It's not going to, do the light housekeeping that you're not able to do temporarily. It is going to provide a nurse to come check on your dressing or wounds. It's going to provide a therapist to do in-home physical therapy or occupational therapy. It's going to be a medical service. And once that service provider has performed that service, they are going to leave. It does not provide the non-medical services under that benefit. For the hospice benefit, Medicare Part A does pay all costs for anybody who has chosen to use the hospice benefit of Medicare. Hospice benefits, of course, are end-of-life care benefits. Again, the doctor does have to certify that you are eligible to use those services. And basically, the doctor is going to have to tell Medicare that your potential lifespan at this point is about 6 months or less. That does not mean you have to die in 6 months by any means. And potentially you could access hospice benefits through Medicare Part A indefinitely, as long as the doctor is able to certify to Medicare on a regular basis that you still meet the eligibility criteria to use those services. There used to be more limits applied to those services, but any sort of timeframes or time limits or quantity limits to both of those services have been removed so that people can access those services and those benefits for as long as they need to. So that is Medicare Part A in a nutshell. Any last questions before we move on to Part B? Real quick before we move on, I will address one more question in the chat box. Wife is 2 years older. Can she get Part A at 65 and I drop her off my work insurance? Okay, probably. So if you have a spouse who is going to be drawing benefits off of your work history and that spouse is older than you, that spouse does have to wait until you, as the person with the work history, becomes at least eligible age for Social Security benefits or Medicare benefits. So if that older spouse needs to draw income, they have to wait until you are at least age 62. And if that spouse wants to draw Medicare, they have to wait until you are at least age 65 before they can draw benefits off of your work history as the younger worker. But yes, they can do that. And once they are eligible to enroll in Medicare, then certainly you could drop them off the employer coverage if that would be more cost effective.
I have one question. Back on chart 17, you said basically that, there we go. That 60 days resets if you fall off the ladder and break your other leg.
Mm-hmm.
But what happens if you fall off the ladder and break your other leg after only 30 days?
So if there is less than 60 days from the time you were originally discharged before you're readmitted to a hospital, you would still be in the same benefit period. So basically, if you spent 5 days in the hospital the first time, 30 days later, you're being readmitted, you're still in the same benefit period. So you're going to start where you left off on you'll be starting day 6 of that benefit period when you're readmitted 30 days later. So they will not charge a new deductible in that scenario, typically.
Okay.
So there has to be at least 60 days before they can charge another deductible is basically how that works.
Okay, thank you.
You're welcome. Any other questions? All right. So that was Part A in a nutshell. So let's talk about Medicare Part B. Medicare Part B is basically going to cover all your outpatient services. So Part A covers all inpatient, Part B covers outpatient. Again, things to take into consideration before you enroll in Part B, or things to know before you're enrolled in Part B. Again, if you're collecting a Social Security income for any reason, when you become eligible for Medicare, Social Security will automatically enroll you in Medicare. Again, if you are actively employed with employer group coverage when you become eligible for Medicare, you can delay enrollment into any part of Medicare in favor of that employer group coverage through active employment. And when that employment ends and that employer coverage ends, you would get that at special enrollment period and an extended amount of time to enroll in A and B without penalty. For Medicare Part B, Absolutely everybody has to pay a premium for Medicare Part B. So most of us will earn Part A at no cost, one way or the other, but everybody has to pay a premium for Part B. And that premium can vary depending on your financial situation. There are some situations where you want to have Part B or may need to have Part B. For example, if you are looking at enrolling in Medicare and you are really interested in getting a Medicare supplement or Medigap, or you want to enroll in a Medicare Advantage plan, you have to have both A and B to enroll in either one of those other options. If you are retired military and you use TRICARE for life, or you have the option of using TRICARE, when you become eligible for Medicare, you are absolutely required to enroll in Medicare at age 65, regardless of whether or not you are still working and have employer group coverage. So anybody who is retired military using TRICARE, you have to enroll in Medicare when you become eligible for Medicare, period. No ifs, ands, or buts. No other coverage allows you to delay that enrollment into Medicare. If you do not enroll in Medicare when you become eligible and you have TRICARE, if you don't enroll in Medicare, you risk losing TRICARE altogether. So you have to register with the DEER's office. You have to enroll in Medicare. If you are using TRICARE, once you enroll in Medicare, TRICARE becomes TRICARE for life and becomes secondary to Medicare. And if you have Medicare and TRICARE for life, quite frankly, you probably have the best coverage available in this country right now. Period. No ifs, ands, or buts. If you are a veteran, meaning you're not retired military, but you are a veteran of the military, and you are using the VA system for medical care, the VA system is not honestly considered healthcare. But I do get quite a few veterans ask me if they should enroll in Part B or if they have to enroll in Part B. Most of the time, they don't feel the need to pay that Part B premium. The bottom line is no part of Medicare is required. All of it is optional. There are different consequences for different decisions you make regarding enrollment into Medicare, but nothing requires you to enroll in Medicare. It's not a law that you have to do that. It's all optional. Veterans probably should enroll in Medicare Part B during their initial enrollment period, even if they use the VA system primarily for their health care. There is benefit to doing that because the VA system typically treats VA issues, whereas Medicare treats anything at any time for any reason. On the downside, Medicare and the VA do not coordinate with each other. Typically, there are some exceptions for some hospitalizations depending on the situation, but the VA will not pick up the coinsurance after Medicare pays first. Medicare will not pick up any VA costs that might be left over. So VA would still be VA. Medicare would be anything for anybody anywhere. So there's pros and cons to it, but it's a situation where if you don't enroll in Medicare when you first become eligible because you do use the VA instead, it would be a situation where you would be allowed to enroll in Medicare later during any general enrollment period, but you would be penalized for late enrollment because you didn't enroll when you first became eligible. And we will be talking about the penalty and the cost here in just a minute. So again, and I keep saying it over and over just because I want to stress the point. If you are still actively employed and you have employer group coverage through that active employment, and the word active is key, you couldn't delay enrollment. Again, into any part of Medicare, you might particularly want to delay enrollment into Medicare Part B because it has a cost. As long as you are actively working, if you delay enrollment into Medicare, While you are working, you can enroll in Medicare at any time while you're actively employed. And again, once that employment ends, you fall under a special enrollment period based on that employment, and you would have an extended window of 8 months to enroll in Medicare once your employment coverage ends without penalty. But again, if you miss your initial enrollment window, if you do not enroll within the 8 months after your employment ends, and that's why you delayed enrollment into Medicare, you would have to wait until a general enrollment period, that January 1st through March 31st timeframe, to enroll in Medicare. If you enroll based on the general enrollment period, coverage would not start until July of that year, and that's when penalties start coming into play for late enrollment. So now let's talk about the cost. So Medicare Part B, the monthly premium, the monthly base premium for most people in 2021 for Medicare Part B, $148.50 per month per person. If you're collecting a Social Security income, or you have railroad retirement, or even a federal pension check, that $148.50 premium would be automatically deducted from that income every month. If you are not collecting Social Security income, then Medicare Part B premium will be billed to you directly. And you would either pay that on a quarterly basis, or Social Security does now have the ability to do electronic funds transfer on a monthly basis. And that can be done either through Social Security or through Medicare. That's one of the perks of a My Medicare account, is you can set up electronic payment for your Medicare premium. If you are imposed a penalty for late enrollment into Medicare Part B, that penalty is calculated at 10% for every year you delayed enrollment and were either not actively employed with employer group coverage. So for example, if you wait 3 years to enroll in Medicare after you turn 65, but you were not working during that time frame, Medicare is going to look at penalizing you 10% for each one of those 3 years. So it's accumulative. So you're looking at a 30% penalty when you do enroll in Medicare. That penalty amount is going to be multiplied by the monthly premium for Medicare Part B of the year you enroll. So to make things easier, if you were eligible for Medicare 3 years ago, you turned 65 3 years ago, but you're going to enroll in Medicare this year, as of yesterday, general enrollment period ended, but say you enrolled last month, Medicare is going to penalize you potentially 10% for each of the last 3 years, so that's 30%. They're going to multiply 30% by the monthly premium of the year you enroll. If you enroll this year, it's $148.50. So it's 30% times $148.50. Whatever that comes out to will be tacked on top of the $148.50 every month, forever, and ever, and ever, and ever. Once you incur a penalty for Medicare premiums, that penalty never goes away, and it is applied to the monthly cost every month forever. The other thing you need to be aware of about Part B premiums is that they are now means tested. What that means is that the more you make in income, the more you may pay in Part B premium. So means tested premiums went into place several years ago. The income limits for means tested premiums are kind of high. I've provided that information in the slides. Based on individual filing or a joint income tax filing. Social Security is who determines who may have to pay higher Part B premiums based on an income. And they are going to base that determination on the most recent, most complete income tax filing with IRS that they can access. What that means is that information that they are accessing and basing a decision on whether or not you have to pay more is old information. So as of right now, they're probably able to look at maybe 2020 income tax filing. Whatever you filed in 2020 is going to be the most complete income tax year they can access. And by the time you turn 65 a year later, you may not have that income anymore. So something to be aware of. They're going to base that, whether or not you hit that income limit, on adjusted gross income. So again, income limits are rather high. For an individual, that threshold starts at $88,000 a year. For a married couple, it starts at $176,000 a year. Again, based on IRS filings, the most complete filing that they can access. If you incur a penalty because your income goes over those amounts, and there are 6 different tiers of income levels that they can apply a different amount of penalty, well, not penalty, a different amount of upgrade or upcharge to your Part B premium. But the first threshold is that $88,000 to $176,000. You'd go from $148.50 a month to $207.90 a month. Again, if you get notice from Social Security that you are going to be required to pay a higher Part B premium based on having a higher income, but the income information they are basing that on no longer exists. So say you made that income last year, but you have since retired and your income has dropped because you have retired and you no longer have that level of income. When you get a notice like that, you can dispute it. Just because you get a notice from Social Security that says you have to pay a higher premium, if your income is no longer at that level, that doesn't mean you're stuck paying a higher Part B premium. That premium can be adjusted based on what your current situation is when you become enrolled in Medicare. So the question is, if you'll turn 65 in July, your premium based, let's see, is my premium based on my 2023 adjusted gross tax records or a different period? Will it adjust again based on my 2024? So again, as income changes, so can the amount that you pay. But it is always going to be based on adjusted gross, and it's going to be based again on old tax information because they can only base it on complete income tax filings. So it's going to be based on what you made 2 years ago and not what you made next year. And if that changes from the time that you filed your most complete tax filing and the time your Medicare actually goes into effect, you can dispute that amount and just have them reprocess it based on your current income. Joint couple filing, the Part B total monthly premium amount, is that per person? Yes, it is. So that premium amount is always going to be a per person premium. Next question is, in the example that I gave of waiting 3 years, you would pay a $45 penalty for Part B this year. So again, that $45 is tacked on top of the $148.50. Can that go up if the premium goes up? The penalty amount never changes once it's assessed. So that 30% or $45 will always stay the same. However, the Part B premium does increase a little bit every year. So that's the only changing factor, would be the amount of the premium. The base premium will go up every year, but the amount of penalty once it's calculated will always stay the same. So that always stays at $45, but yes, the premium will increase a little bit every year. But the penalty again does not go up. So it would be, if the premium goes up to $200 a month, your total premium would be $245 because the penalty will always stay at $45. Does it make more sense to file separately? That I cannot answer. I not only have no idea about giving tax advice, I don't want any idea about giving tax advice. So unfortunately, I would have to refer you to a tax advisor for that. And how do you challenge the amount that you pay? So if you are given a notice or if you receive a notice from Social Security that suggests that you may have to pay a higher Part B premium based on income, that notice will also explain in detail what you can do if you disagree with that information. So Social Security typically likes to send 6 pages, 4 to 6 pages in anything they ever send you. And most of the time, it's only the first paragraph or 2 that tells you anything relevant. But if you continue reading the rest of those pages, the process to appeal that determination is outlined in detail, as well as providing any instructions. It also gives you any timeframes you have to make that appeal in. So you do have to read that document carefully, but be sure you read that document because it does give you everything you need to know. Does the penalty ever expire? Unfortunately, it does not. Once you incur a penalty to your Part B premium, it is there forever and ever and ever. It never goes away. The only time it would potentially go away is if your financial situation took a complete reversal and somehow you found your total monthly income fell below a certain financial threshold, then you may qualify for the state to pay your Part B premium. That would be the only time you would ever have to worry about the penalty going away, because if you're not paying the premium, you don't have to pay the penalty either. But otherwise, that penalty is a lifetime penalty. So hopefully that answered all those questions. Again, just things that you need to be aware of. One thing I can tell you is when it comes to Medicare, there is always, always, always a process if you disagree. So you never, ever have to just assume that whether you like it or not, if they're telling you you have to do something, that's correct. If you don't feel it's correct, or if you don't feel it's accurate, or you don't feel you fall under that specific scenario anymore, there is always a process to disagree with the system. And that process will always be outlined in anything that they ever mail to you, whether it's Social Security or Medicare. Okay, so after all that rigmarole, now that you're enrolled in Medicare, what you need to be aware of is Medicare Part B does have a deductible as well. The Medicare Part B deductible is annual, one time a year, drop in the bucket. For 2021, the Part B deductible is $203. Again, that deductible is applied annually. If you become eligible and enrolled in Medicare next month, because you have not met the 2021 annual deductible yet, whatever services you have first in this calendar year would be applied to that deductible. And then starting January 1st next year and every year thereafter, whatever service you have first each calendar year would be applied to that deductible. So they base it on calendar years, but it is a one-time a year deductible. Once that deductible is met, then Medicare pays for most Part B services at an 80-20 split. They pay 80%, the 20% left over is your responsibility, unless you choose to get another insurance that would pay that for you. So what do you get for all that? Well, again, Medicare Part B is going to cover any and all of your outpatient needs. That includes doctors of any kind, primary or specialist, any lab or x-rays, covers all medical, surgical, and anesthesia services, and Medicare does pay for medical second opinions. Again, no part of Medicare covers the first 3 pints of blood you might need, but Part B will start paying for blood at pint number 4. Covers any emergency ambulance rides you may need, covers any of your vaccines, including the annual flu shot, hepatitis, pneumonia, the shingles vaccine. Quick question, why not? I'm assuming you're asking why don't they pay for blood, the first 3 pints of blood? And if that's the question you're asking, unfortunately, I cannot tell you. I've been doing this job for 21 years. I have never been able to find out why they do not pay for the first 3 pints of blood. Nor do I know how much the first 3 pints of blood cost, unfortunately. Yeah, after 20 years, I've still not gotten a straight answer as to why they do not pay for the first 3 pints of blood. They simply do not, under any part of Medicare. Part B also covers all of your therapies, physical, occupational, and speech therapies, outpatient with some limits. However, most limits for outpatient therapies, again, have been removed. So there used to be a dollar limit to how much physical therapy Medicare would cover in a given year. That dollar limit has been removed, was removed a couple years ago. So there could be some limits to those benefits, but most of those limits have been removed. Medicare Part B covers all of your durable medical equipment. That's going to be your oxygen concentrators, what have you. It's going to be your walkers, wheelchairs, hospital beds, all of those kinds of things for home use are covered under Part B. And then there is some limited coverage for other services as long as there is medical necessity. Other services being chiropractic or podiatry or I forget what the other one is. Podiatry, chiropractic, and I'm drawing a blank, sorry. So most services, as long as there is medical necessity, again, Medicare will cover any medical need you may ever have, and with very few limits. There are, as with Part A, there are some things Medicare Part B will not pay for. Routine annual exams or annual physicals are not a benefit of Medicare. Routine foot care is not a benefit of Medicare. Hearing aids or the fitting of them are not covered by Medicare. Routine eye exams or the glasses associated with them, not covered. Even in a medically necessary covered eye visit or a visit to an eye doctor, if that doctor does a refraction of your eyes where they shine the bright light and you can't see for a few hours, even if the rest of that visit is covered by Medicare, that refraction is not. Currently, Medicare does not cover dental in any way, shape, or form. And again, we're talking about original Medicare A and B. And of course, Medicare would not cover anything that they would consider cosmetic surgery or service. Medicare will only pay for medically necessary services. Having given you that list of what's not covered, what I can tell you is that Medicare does not cover routine annual physicals. Medicare's answer to that is they will cover a welcome to Medicare visit and an annual wellness review. They will not cover routine foot care. However, if you have a medically necessary reason that you cannot do your own foot care, such as diabetes or pulmonary vascular disease, Medicare will pay for you to see a podiatrist. Hearing aids or the fitting of them are not going to be covered. However, Medicare may pay for a hearing test or something similar if your doctor is trying to diagnose a neurological issue. Eye exams. Again, Medicare will not pay for routine. So if you're going to the eye doctor to see if your prescription glasses have changed or your prescription has changed for your glasses, that is not going to be covered, nor are the glasses associated with that. However, if you are going to an eye doctor because you're developing glaucoma or cataracts, poke yourself in the eye with a pencil. Those are medically necessary reasons to see the eye doctor. Medicare would pay for that. Dental, at this point, there are no exceptions for dental care. However, I can tell you that dental is always a hot topic at the federal level. And 10 years ago, I would have said, I don't think I'll ever see dental benefits through Medicare in my lifetime. Today, I'm not so sure. Dental benefits could be a benefit of Medicare anytime in the next 5 or 10 years. And of course, cosmetic, because it's not going to be considered medically necessary, will probably never be covered by Medicare. So Medicare won't pay for routine services, as we just looked at. Quick question. Would it cover eye exam for a person with diabetes? Yes. So if you have a medically necessary reason that you need to see that eye doctor, such as diabetes, and that doctor needs to check whether or not you're developing any sort of eye issue, absolutely Medicare would pay for that. What they won't pay for is you go into the optometrist to see if you need new glasses. And that's the only reason you're there. That is not going to be covered by Medicare. So again, as we see the key to what Medicare will not pay for, you see the word routine multiple times. Medicare used to consider routine a lot of things routine. A lot of services that are now reclassified as preventive used to be classified as routine through Medicare. When preventive coverage, preventive services became the big thing to have insurance covered, several years ago, Medicare jumped on that bandwagon with both feet. So again, many services that Medicare used to deny because they were considered routine services, Medicare now covers at 100% because they're classified as preventive services. Medicare covers a huge list of preventive services, and all preventive services are paid for at 100%. Again, Medicare doesn't cover the routine annual physical, but their answer to that is the Welcome to Medicare preventive visit or an annual wellness review, keeping in mind that neither one of these visits are an exam. What these visits are that Medicare will pay for are in-depth conversations with your doctor. They are not exams. There will be no lab work done. There will be no testing done. There will be no EKGs done. They are in-depth discussions with your doctor. During that in-depth discussion, that doctor may suggest or recommend that you do actually get other preventive services. Cardiovascular screening, I can't even say it today, diabetic screening and services and supplies. Again, the list of preventive services that Medicare will cover is huge. It's very, very long. The best way to see that list is to access the Medicare and You handbook. In the Medicare and You handbook, there is like a 30-page section that goes into detail about preventive services that Medicare will pay for. It tells you what the service is, what the eligibility criteria is for a doctor to suggest you get that service, and how often you can get that service. Any of those descriptions that are actually a preventive service will be indicated by a little blue apple next to it. And most of those services described in that 30-page section will have little blue apples. You can access the Medicare and You handbook either by going to medicare.gov and downloading it as a PDF, or you can call 1-800-MEDICARE and ask them to mail you a hard copy. If you're becoming eligible for Medicare this year, you probably won't get a hard copy in the mail unless you ask for it. However, once you're enrolled in Medicare, so if you enroll in Medicare this year, next fall, when Medicare mails everyone a Medicare and You handbook, you will probably get one automatically. But if you want to access a hard copy, you would need to call 1-800-MEDICARE and ask them to send that to you. And you'd want to ask them to send one that is Colorado specific. Otherwise, you can look at the Medicare and You handbook on the medicare.gov website and download it as a PDF. It is basically going to be the only manual that is going to explain your Medicare benefits outside of coming to a SHIP counselor. And we're almost done here. There is some programs that are available through the government. that provide people who are on limited or low income some financial assistance with some of these costs that we've talked about tonight. The financial assistance that would help pay some of the Medicare A and B costs is called Medicare Savings Program. Medicare Savings Program can help cover or help with the cost of the Medicare Part B premium if you are at a higher income, or it could not only cover the Part B premium, but it may also cover your A and B deductibles, as well as any co-insurances that Medicare left over at the lower income level. If you are eligible and you apply for Medicare Savings Program, it also automatically would come with assistance for Part D costs, which we will talk about down the road. To apply for a Medicare Savings Program, you do that a Medicaid application through the Department of Human Services. This is a federal program that is provided directly through Medicare, but you do have to apply for it at the local level of Department of Human Services. And there are income and asset criteria that you have to fall within. The income and asset criteria has not changed for 2021 yet. So we're still going by the 2020 income limits. The asset limits have been adjusted for 2021. If anybody wants any additional information or wants to talk about these programs in more detail, you are always welcome to contact me or call our office and talk to a SHIP counselor. And we're happy to talk to you and review that criteria. And we do help with these applications. And we're happy to talk to people about this program at any time. And that's it. That is all I have for you tonight. Of course, if you still have questions or you do want to talk to a SHIP counselor in more detail about your specific situation, you're always welcome to give us a call or shoot us an email. Again, we are your federally trained and contracted counselors for Medicare concerns and education. You can reach us by calling our toll-free statewide number. If you call that number from anywhere in the 9 counties that this office serves, you will be directed to our office. If you want more information in general about the SHIP program, you can go online to the shiptacenter.org. Our office typically is also the Senior Medicare Patrol Agency, which is the fraud program for Medicare counseling. So anytime anybody has any questions or concerns, billing concerns, marketing concerns, scams, fraud, anything like that, you would also be welcome to call our office and we could help you address any of those concerns, as well as help you make any appeals or any complaint filings. If you have a legitimate concern regarding fraud or abuse, we are happy to talk to you about that as well. We are always looking for volunteers. So this is a government funded program, a federally funded program. It's funded by the state and by the federal government. But of course, that funding is never going to be enough. So we are always looking for volunteers. If you are looking for a volunteer opportunity and you are looking for an opportunity that is challenging, educational, and is a true help to the community, then we are looking for you. All training is done locally and through our office. So if anybody wants any additional information about volunteering, please contact me. And that is it for tonight. That's all we have. Any last minute questions?
On the vaccines, will they cover COVID-19 vaccines or whatever the next iteration of COVID is?
So of course, vaccines for this COVID-19 have been covered by the government. And whether you have Medicare or not, the vaccine has been at no cost, but specifically for Medicare beneficiaries, funding was allocated directly to Medicare for Medicare providers to bill and get reimbursed by administering vaccines to people with Medicare. And I think that will always be the case. But hopefully we don't have to go through this again anytime soon. But yeah, if that's ever a concern, that would be covered, absolutely.
Thank you.
You're welcome. All right. Again, anytime you have any questions, you're welcome to give us a call, shoot us an email. You can always email, and I looks like I forgot to put my email in here. You can always email me at shiphelp@ppacg.org. You can call the toll-free 888 number, or at the very beginning of the presentation, there was a slide that gave you our local office number, and talk to a SHIP counselor directly. We do have 5 counselors at our agency and 1 volunteer, so we are always available to speak with you. And hopefully one of these days soon, we will actually be able to go back to the office and talk to people face to face. Again, the email address, if you have questions that you want to email to me, you can either respond to the email I sent you earlier today with the handouts, which is my work email, or you can always email shiphelp. Or no, what is my email? seniorinsure@ppacg.org. So that's senior insure, INSUR, at pp, P as in Paul, acg.org. And I'll type it into the chat box as well. All right, well, if there's no other questions, again, I really appreciate you guys joining us tonight. Hopefully I will have you again next week for part 2 of our presentation series. Next week, we will be talking about Medicare supplements and Medicare Advantage plans, which is always a lot of fun and a lot of people have lots of questions about. So hopefully I will see you next week. Otherwise, email or call with any other questions in the meantime, and hopefully I will see you next week.
Thank you.